Our next speaker is Dr. Milos Popovic, who you've already heard introduced. He's recently appointed as Toronto Rehab's Director of Research of our Research Institute. He was previously Toronto Rehab's Chair in Spinal Cord Research and led the Neural Engineering and Therapeutics team at Toronto Rehab's Research Institute. In 2014, he was UHN's Inventor of the Year for MindMove, which is a product that's been commercialized that non-invasively provides electrical stimulation to people to promote recovery of paralyzed muscles. You've heard already about his role in CRANIA, and over the last year since he took over the role as research director, he's led the rebranding of our research institute as KITE, Knowledge, Innovation, Talent Everywhere, and we are grateful that he's going to join us to tell us a bit more about CRANIA. Milos?
Thank you, Mark. So, as you see, well, I'm going to talk about CRANIA, and that's the effort that Taufik and I have been working on for a couple of years now. It's a center for advancing neurotechnological innovations to application. And the reason for that is that globally, the brain disorders account for about 25% of the disease burden. And when you look at the diseases such as heart disease or cancer, they're almost half of that number. And the dominant disorders in brain disorders are, of course, various neurological disorders, mental health and addiction, stroke, and then back pain and neck pain. CRANIA is actually focused on a particular type of technologies. It's called neuromodulation. Neuromodulation is the way how you change or adjust or tweak the brain function by stimulating different components either in the brain or in the spinal cord or in the peripheral nervous system. And you can either reduce the symptoms of the disorder or the disease, or you can address the underlying components of the disorder. So a couple of the neuromodulation established neuromodulation therapies, some of them that we practice here at UHN, at Cranbrook, at Toronto Rehab and KITE, is functional electrical stimulation, which we use to improve control of upper limbs following the stroke or spinal cord injury. We deliver this therapy over 40 hours, and after that, the patients essentially should be able to reach and grasp while they were not able to do that prior to that. The other one where we piloted this, we're one of the centers in the world which were piloting this technology. It's deep brain stimulation. It's done by a team led by Andres Lozano. It's technology which is primarily used in Parkinson's disease patients, but not only now. In this patient population is to reduce motor symptoms and conditions following Parkinson's disease. So it doesn't treat the disease, but it alleviates the symptoms dramatically. The other one, which is actually in the domain where Taufik operates, is stimulation of vagus nerve to treat seizures in epileptic patients, and that's a technology that has been used wider and wider in this population. So as you can see, in this particular case, by stimulating peripheral nerve, you change the way the brain functions. So what we are trying to do is we have realized, Taufik and I have realized there's this fantastic opportunity to bring neurologists, neurosurgeons, engineers, computer scientists, and basic scientists across all these disciplines to work together on this type of technology. And we thought very strongly at the time when we envisioned that we can create a world-class center for research and development in application and commercialization of neuromodulation technologies and interventions in Toronto. Our mission is to accelerate this translation of neuromodulation research to patient solutions. And our vision is to actually help every individual unlock the brain's potential for better quality of life. One of the things that Taufik has been stressing for the day one is we want to focus on the technologies that will have first-to-clinic applications in neuromodulation within the next 5 years. So everything that we're trying to do is focusing on getting technologies, solutions, ideas that could be turned into things that our patients can benefit from within 5 to 7 years. These are the partners. The key partners is, of course, Toronto Rehabilitation Institute, Cranbrook Research Institute at UHN, then at the University of Toronto Faculty of Applied Science and Engineering, Faculty of Medicine, Faculty of Dentistry, and Faculty of Arts and Sciences. In the broader Toronto ecosystem, we are working together with Baycrest, Sunnybrook, CAMH, Sick Kids, and St. Michael, and we call this Neuromodulation Collaboratory in Toronto. One of the core activities is essentially designing technology, from designing electrodes and coatings for the neuroimplants and neuroimplants themselves, to coming up with different locations where we can deploy this neuromodulation technology, either in the brain or a peripheral system, testing these technologies in animal models, and using those implantable systems with external devices and external sensors or internal sensors to close the loop, so monitor the patient activity, and based on that, make a decision what kind of treatment and when to deliver it. And of course, all this is nicely submerged in a cloud-based capabilities where all this data is collected, analyzed, and informs all the aspects of this research. We're very proud that the laboratories are going to be established in early October. So this is the schematics of that. It's going to be at Cranbrook Research Institute. And this is the OR that, or it's one of the drawings of the ORs that is evolving. And that will be also at the Toronto Western Hospital. And what we're very excited about is we actually convinced the University of Toronto, particularly Faculty of Applied Science and Engineering, and now Faculty of Medicine and Faculty of Arts and Sciences is coming together to create actually an educational enterprise where we will train and teach new generation of scientists in neuromodulation. And one of the interesting things is that originally this was initiated and supported by the engineering faculty. Arts and Sciences and Faculty of Medicine are integral part of this, and we are hoping to have this approved within this year so that the Institute will start in 2020, and that's when we will start training new generation of PhD students, medical doctors, and others. By the way, we already have students engaged, but that will be the time when we will have our course and curriculum and everything else. We're very proud to announce that we have a first CRANIA Conference, which will be on September 16th, and those of you who are interested, you're more than welcome to join us. So I have selected a number of projects that we've been working on or having, and I'll just go quickly through them. So one of the things that we are aggressively pursuing right now is we have been in a space of surface electrical stimulation for improving locomotion and grasping and sitting and balancing. And one of the challenges is how we deliver that. So we are in the process of working with industrial partner to create a textile solution. So instead of having electrodes and cables and all this stuff, you just have to put tight pants, and that should do the job. The other aspect of the effort is to actually use brain-machine interfaces, so recording of the brain activity to control these devices, and that's done by Cesar Marquez Chin. The other thing which we are also working on is developing different neuroimplants and neuromodulation technologies. This particular one is done by Dr. Valiente, Taufik, and Roman Genov. So they're exploring the ways of recording the brain activity, predicting the seizures, and based on these predictions to go in and try to tame down or control the seizure. And they're working with various industrial partners on that. There's another research that is done in collaboration with Cindy Morished and Hani Naguib, which is using electrical stimulation as the way to help move stem cells in the brain. So you can identify where the stem cells are. Through electrical stimulation, you can double or quadruple their production, and then using electrical stimulation, you can direct them to move to the parts of the brain where you think you should be repairing or helping brain recover the function. Originally, the intent is for stroke, but there's definitely applications in Alzheimer's and dementia. One which is kind of an interesting project that we've been doing, we have been using stimulation of electrical stimulation of the facial muscles to treat major depressive disorders, and phase 1 trial has been just completed, and we had really good results. So we're now looking at the mechanisms of that, and this is run by Dr. Jose Zarifa. And the last one, which I want to mention, is the work from Taufik and his team. It's about using electrical stimulation, deep brain stimulation, to treat memory. And that's it. Thank you.